Hey friend, come on in, listen up. I have a question for you. Do you grieve appropriately? Do you grieve appropriately? The word HALT doesn't just mean stop, but it's actually an acronym. It stands for H, hungry, A, angry, L, lonely, tired, HALT. If you are hungry, angry, lonely, tired, you need to halt. Stay silent, don't speak, because you will come to say the best speech you've come to regret. And in the moments of when we need to halt, it's often a moment of grief that has occurred. And now I'm not just talking about when someone passes away. I'm speaking about when there's been a change in jobs, a change in structure, unexpected news, devastating news, a loss of a child. This is grief, an expectation you didn't have, you didn't bargain for. Any of those things cause grief. And if that's not dealt with appropriately, what will happen is what I saw in office this week. Patients that I know for all this time who happen to have unexpected news come in with high blood pressure. So really quickly, give me 2 minutes, not 3, just 2. I want to discuss really quickly with you the stages of grief, the 5 stages and what they look like and why it's so important for you to make sure you grieve appropriately. First stage, denial. Denial is that point where you're like, this cannot be true. Some of the things that might be going on in your mind is avoidance, confusion, elation. It could be shock, fear, any one of those things, the denial. The second thing, the second stage of it is anger. This is the frustration. This is the anxiety. This is the irritation. This is the thing where everything gets on your nerves. That's the moment of anger. The third, bargaining. Bargaining is where you're suddenly trying to look for meaning, find meaning, or even starting to say, if I did this, maybe that would have occurred, or I should have known this. All of those things are bargaining. And this is where you're reaching out to others. This is where you want to tell your story. This is where you want to talk more and more about what's going on, because again, this is this bargaining situation. Stage 4, next one is depression. This is where you feel overwhelmed. This is where you feel helpless, hostile, fights. If you've noticed that you're getting in more arguments, disagreements, just the talking, all of that, and you recently had an unexpected loss, this is the stages of grief. And guess what? It's normal. And here's the final one, acceptance. This is when you're finally accepting, you're exploring. What is the new plan in place? Well, how am I going to move on? Where am I going to go? And here's the tricky thing. Now, I just said this as if it's a stage where you progress 1, 2, 3, 4, 5. But the reality is, you can go up and down that in any given 30 seconds. That's right. You can get to the point of acceptance, then go right back to anger, and then go back to denial, and then go back to bargaining, and then go back to denial, and then all of that. Those are the 5 stages of grief. Do you grieve appropriately? Has there been an unexpected thing that occurred, and now you find yourself in any of those situations that I've spoken about? And I want to tell you, friend, like I always say, your health is not physically what you see. It's a combination of your physical, spiritual, emotional health. All 3 of those components come together. That's what makes you healthy. And if you're not grieving appropriately, unfortunately, it could show up in your physical health, like high blood pressure. If you need more information, if you need help, you know what to do. This is Cornerstone Medical Group. This is concierge care. This is preventive care. This is total care. And I'm Dr. Sabine Lizette. Reach out, you know what to do.